So let's focus on the outcomes and let's quit focusing on this is the way we've always done it. Medicine has been too much, unfortunately, about tradition and permission instead of disruption. In Silicon Valley, right here a few miles from where I live, it's all about disruption. Let's do something new. Let's do something different. But medicine needs to be a little more Silicon Valley and a little less tradition and permission when it comes to untreatable diseases.
Many people are incredibly excited and optimistic by personalized medicine and significant changes to the healthcare system, where you could factor in, wearables that are giving you day-to-day feedback on how you're doing is almost the entry point, but then looking at a complete breakdown of your genetic code, complete breakdown of all of the genetic risk factors you have. And so you can begin to build a complete picture of an individual's health from potentially from before birth and then monitor it through. How excited are you by this transition towards a truly personalized approach? And is this going to be the cure, not just for Alzheimer's and other neurodegenerative diseases, but could this be the panacea for everything? Are we going to be able to eradicate cancer and leukemia and every single disease under the sun, because we're treating an individual purely as an individual and giving them what they need, not basing all their treatment on what works for the average or for the mean?
Right. So this is exactly what we're doing. This is exactly what we came from the test tubes to say, okay, this is a network. You can't just do one little simple thing. Now, here's the interesting thing. 20th century was the century of simple illnesses, diphtheria, tuberculosis, polio, and those were conquered largely by simple approaches, and I include vaccines in that with things like polio and things, but antibiotics and public health measures. That was the big success of 20th century medicine. What happened? We all now have these more complex chronic illnesses. So I agree with you. The 21st century is the century to conquer complex chronic illnesses, Alzheimer's, Parkinson's, other neurodegenerative conditions, cancers, as you said, things like leukemia, but also things like schizophrenia. So my argument, and actually I made this in one of the books, that by the end of this century, these things will all be rare diseases. Lupus, all the things where we didn't really understand what it was. We just gave it a name. And that's, lupus and PSP and CBD and all these sorts of things. But when we conquer those, and it's going to be, as you said, it's going to be all these things, there are two issues. Number one, we can't give every single person on the planet a $10 million workup. It's just not feasible yet. So we need now to have strategic public health approaches where what we do is we take everyone and do the basics. A few of those people will fall through the cracks. They get a more extensive workup. A couple of those people will fall, and you just go right up the list. So now overall the resources work. This idea that everyone's got to have genetics and epigenetics and all the biochemistry. That's the first piece. The other piece is once we conquer those, then the next set of things that limits the organisms that we are is going to come into focus. And I think that's going to be more about the fundamentals of aging. Up until now, aging has been mostly you suck at living. And that's been the major thing that drives aging is, you ate an inflammatory diet, you did all the wrong things, you got heart disease, you got cancers, you were exposed to all sorts of toxins. When we get rid of that chronic illness approach, now it's going to be, okay, is it your telomeres that are going to limit you? Is it going to be the batteries run down? Can we get you more mitochondria? It's going to be the things that Aubrey talks about. And I think that's going to be really interesting, but it's going to be now that's the next great frontier. So I do look for these chronic illnesses to be largely preventable and reversible, especially early on in this century.
Your outline of how the future of medical treatment, no one could have an issue with getting on board with that as a philosophy. It makes perfect sense. Give everyone the fundamental treatment they need at that first measure, preventative all the way. It sounds great. The trouble is that's a complete inversion of the current system we've got, where you only begin to get treatment once you're probably almost too far down the road in certain illnesses to see a reversal. my question is, what is going to have to change to make this huge public policy, just a complete change of the landscape, how we consider medicine, how everything has to change? Is it too big an ask?
This is the huge question, because it's what's limiting us right now. And I've been surprised. When you say to someone, you've got a medical and a healthcare system, please, let's add one little bit to this. We'll keep the system in place. That's pretty easy, and that's what's been going on for many, many years. We're now saying, no, you've got to destroy that entire system and replace it with a better system. You can imagine the people who are there do not want to be replaced. So this goes back, to Buckminster Fuller, as he says, you don't work from within. You create something that makes the current system obsolete, and that's what's ongoing right now. We are showing that the current system is obsolete when it comes to these chronic illnesses. So what it's going to take is, it's going to take champions with influence. It's going to be someone from a congressman's family got sick and got better because of one approach and not another approach. It's that sort of thing. And people, you're already seeing this with people, doing things like, well, you probably saw this. Jeff Bezos just put in over $1 billion to reprogram cells. So, okay, that's a huge step. And that's not going to be something that's going to be easy to do for every single person. So we need to reevaluate. It's going to take, it's going to take Congress going to NIH and saying, please reconsider. We're now going to change the healthcare system. And of course, the problem has been healthcare is all about making dollars. And the way to do that is charge people as much as you can up front and give them as little as you can on the back end. What a horrible system. That's a scam. That's not a system. And so it's going to take people saying, you know what, we can do better. And I think the way that we're going to get there is continue to publish better and better results with using these new approaches until you just can't ignore it. It's fascinating to me that scurvy was recognized 16th century, 17th century, 18th century, 19th century. And yet each time the medical establishment would say, no, that's not the way to do it. We're the experts. We know better. And so they lost so many people to scurvy because they weren't willing to admit that, yes, there is something going on here. We got to get citrus into these people. And the same thing happened with germ theory, of course. Semmelweis in the early 1800s was killed because he showed that you can actually reduce the number of people who would die after childbirth by washing your hands in an appropriate solution. But because people didn't understand what germs were at that time, they said that's ridiculous. They actually ended up confining him against his will to a mental health facility where, ironically, he died of an infection very shortly. So, things got to change.
Do you feel that health systems such as in the UK with the National Health Service and the single payer system, where such a huge proportion of the NHS budget is spent on the elderly, is by far the most expensive part of the healthcare system, do you feel that maybe countries such as the UK could be a trailblazer in this respect? Because we could see, as people live longer, and we are all living longer, there becomes a huge impetus to make sure people are living healthier, not just longer, and that quality of life is there. If you can remove some of that burden on the budget, such as the NHS, by removing neurodegenerative diseases, do you feel that could help maybe sway the conversation in the US and other systems where it is purely insurance based?
It's a great point. And it's interesting. I've thought for years that the place that is going to make this work first is Singapore, because it's a small group. They're very sophisticated. They're very interested in healthcare. And in fact, they're very interested in dementia. Now, as you probably know, dementia is the #1 cause of death in UK females and #2 cause of death overall for the UK. So this is a huge problem. But what happens? You have experts who have done it the old-fashioned way for years, and they're always going to be consulted. So when are those experts going to say, you know what, maybe we've been going down the wrong track? trail, and maybe, we should be doing this differently. So yeah, I think the UK is in a good position because it has a rational and powerful government to say, you know what, we really got to rethink this. And so, my hope is that that would be one of the earlier places. And then places like the US, where it's all about the almighty dollar, would say, maybe we can do better by changing this.
Your work has gone against conventional wisdom and some of the experts you've just mentioned. And like anyone with pioneering breakthroughs, you're going to attract a deal of criticism and critics. What do you think some of the main misconceptions are about your work that you'd like to put the record straight?
Yeah, thanks for offering that, because I've been absolutely vilified by some of these people. There's a graduate student in Paris who's making it his job to say I'm a horrible person and this is not the way to do it. We got to get a drug for this. And look, I have no problem with getting a drug as long as they work. So it's about outcomes. Everything that should be done should be about outcomes. Can we reduce the global burden of dementia? So one criticism was, okay, you're publishing case studies. Yes, you have to start somewhere. When you're changing a fundamental approach to an illness where there has been nothing before, you have to start somewhere. So bear with us. We've gone from few case studies to many case studies, 100 that we published at once with documented improvements, to a proof of concept trial, and now to a randomized controlled trial. Now, I realize some people will just keep putting the bar higher, 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 higher. We've already done better, but let's at the same time look at compassionate use. Everybody understands the term compassionate use. If you've got a drug that's for one disease, and you say, wait a minute, it looks like even though it's not yet approved for something else, it's the only thing that can help people with X. That's compassionate use, and it's been very valuable at times. So what we've been doing is compassionate use. Let's do the best we can for these people, and let's at the same time encourage them to come in earlier. So that would be the next thing I would say is, give us a chance to make these people better. And then look, let's be honest about the trial outcomes. When you look at the drugs, lecanemab, donanemab, aducanumab, there have been billions spent on these. What they do is they don't make you better. They don't keep you the same. They slow the decline slightly. What has done better than those drugs? Number one, extra virgin olive oil alone. There's a publication on this. It actually got better results than those drugs. Number two, ketones alone. This was very nice work published by Professor Stephen Kinane. Number three, so-called combined metabolic activators. It's 4 things like nicotinamide riboside that are simply trying to give you more energy. And again, as we talked about earlier, that makes sense in Alzheimer's, but you've got to also go in the long run, you got to also go after the immune system. But doing that helped people. They got much better results than those drugs. And then, of course, the approach that we have taken has gotten the best results of all. So let's focus on the outcomes and let's quit focusing on this is the way we've always done it. Medicine has been too much, unfortunately, about tradition and permission instead of disruption. In Silicon Valley, right here a few miles from where I live, it's all about disruption. Let's do something new. Let's do something different. But medicine needs to be a little more Silicon Valley and a little less tradition and permission when it comes to untreatable diseases. Sure, we can do a good appendectomy. No reason to change that. But when you're talking about neurodegenerative disease, if you've got nothing, something is better than nothing if it's getting better outcomes.